Hi everyone, this is Dr. Lahari from Leo Dental, Bangalore. Sometimes, even for the adults, when you have a unforeseen accident, RTA, that is road traffic accident, or a trauma or a fall, the first things that are affected on the face besides the nose are the teeth. In children, the parachute reflex or some reflexes, when they are not yet developed, they tend to fall on their face very frequently and they break their teeth. Even in adults, when we fall on a face, there is 96% probability that will be affecting our teeth. What should we do when our tooth is broken? So, or you had a injury to your tooth. Initially, don't touch the area with your hand. When a tooth is broken, definitely the lip is also lacerated and it presents a very ghastly picture. It makes us panic a lot, but don't panic. Wash the face or the bleeding with distilled or clean water source that is available. Control the bleeding first. After you control the bleeding, look at your teeth. If the tooth is broken, there are three portions of the tooth. First, the incisal portion. Only the incisal portion is broken, the other tooth is intact, then it is a very good sign that the teeth can be saved. If the middle portion of the tooth is broken and it is bleeding from the tooth, that indicates even the pulp or the tooth nerve has been affected by the tooth and you have to immediately see the doctor. In the worst case, when the tooth has come out of the socket, you have to inspect the tooth whether it has come in toto, that is incomplete, or broken into half and it is lying in the hand. So, if the tooth is broken completely, it has been removed or avulsed from the cavity completely, don't dry the tooth. Wash it under clean water. If you can find milk, then that is the best solution or carrier to carry the tooth to the dentist. Or else take a small pouch, fill it with clean distilled water, take the broken tooth, put it in there, tie it up and rush to the dentist immediately. The dentist, after examining the site and the tooth, will decide whether the tooth can be replanted again. In most of the cases, replantation would not be possible because it would be very late when they reach the dentist, or the teeth would be contaminated by the time they reach the dentist. What if the tooth is broken into two? That is a different picture. Then a radiograph or X-ray would be taken, will determine how much of the tooth is broken. Can we save the tooth? If less than half of the tooth is broken, a root canal treatment is advised. After the root canal treatment, a proper crown will be given to the tooth. When the tooth is broken at a root level, nothing can be made to save the tooth. That time, the tooth will be extracted completely and then it is left to heal. After it has been healed, the definite decision to whether to replace it through an implant or through a bridge would be taken according to the patient and the dentist. So, whenever you have a broken tooth, never delay seeing a dentist, which will lead to secondary infections. Try to save the teeth. Get the specimen to the dentist so that he can assess the tooth. Whenever a tooth is broken, try to keep the area moist. Don't dry it, but keep it safe and clean, and it is covered by a sterilized or a clean piece of cloth. And don't panic, it can be attended. Try to see the dentist immediately, and the first thing in the mind you should be having is to control the bleeding immediately. Thank you.